Welcome back. The next panel is in partnership with Movember and is particularly relevant at the moment. Young people have really struggled during the COVID lockdowns, and Evening Standard Campaigns editor David Cohen and Movember's Director of Social Impact Campaigns Mark Sanderson share their insights.
We all know how hard it is to be locked down and for this pandemic to be producing twists and turns that surprise and shock us daily.
The pandemic's affected my mental health because of the change in structure it's brought to my life.
The level of child and adolescent mental health problems we're seeing today is unprecedented. It's the highest since records began. What is particularly sad about this is that it's hidden.
Life for young people is almost turning into a circle of uncertainty. People are now living in doubt of when life will go back to normality. For myself, I've found this has caused me to feel quite unmotivated and uninspired.
I started getting quite lonely, and I think I found the whole lack of social connection really, really challenging.
I'm so used to having breakfast at 8, lessons at 9 and the netball at lunchtime.
We have a large number of children who before COVID did not have mental health problems, but since the start of the pandemic have developed one.
I can't handle lessons and I don't feel like speaking some days. I get scared because I'm having some very dark thoughts.
And in some cases you can expect it because children live with parents with them who themselves have mental health issues. But in other instances, you couldn't have predicted it.
With all of us cooped up at home, it is hard to find quiet space to revise. It's a dull existence, stay in your house all day, then go to sleep. It's easy to feel tired and listless all the time.
We have yet to see the impact of this lockdown, and I think the worst is yet to come.
This pandemic and the lockdown has taken that away from me, that physical element that I needed to stay happy and stay connected.
So there's so much more than missing their friends. They need them. They're dependent on them, and it has to be in person, not just via social media. So if you take them away, if you cut them adrift, they can unravel and fragment, and that is why you're seeing so many of them struggle now.
When things are in your head, that feels so much bigger, and as soon as you can get that out, talk to a family member or to a friend about it, it feels much more manageable.
Because we've got lots of effective treatments for anxiety, depression, disruptive behaviour, ADHD, anorexia. We can do so much good, and it isn't just, these illnesses are short-lived, they last for years.
The tragedy is that so many young people feel that they have to go through the depression, the anxiety, and issues like self-harm alone. But actually, help is at hand. The time to act is now. Hi everyone, welcome to the session. I'm David Cohen, Campaigns Editor and Investigations Editor on the London Evening Standard. Today I'm going to be in conversation with Mark Sanderson, the Director of Social Impact Campaigns of our program sponsor, Movember. Now, Mark has very good reason to be here because Movember are a charity that support the mental health of men and are actively campaigning in this regard. My excuse? Well, 2 months ago, I launched an Evening Standard campaign called Young London SOS to support the mental health of young people in the wake of the pandemic. We're going to have a chat and talk about our respective campaigns and a lot more besides. Hi, Mark.
Hi, David. Great to see you again.
Good to see you. Perhaps we can start with just telling us a little bit about Movember, about the work you do, why it was set up, and also a little about the research you have done with young men under lockdown.
Sure. So Movember is the world's largest men's health charity. It's been around for 17 years, and many of you will probably know it through the moustache growing in the month of November. And indeed, that's a core part of what the organisation does. It raises funds by getting millions of people over the last 17 years to raise money. And indeed, it's raised, I think, $1 billion Australian dollars, which is a significant amount, obviously, and it's managed to funnel that money into 1,250 programs around the world to improve the lives and the health of men. The focus of the charity is around testicular cancer, prostate cancer, and mental health. And given everything that's going on at the moment, mental health and suicide prevention is of primary concern for the charity. And given that 3/4 of all suicides are male, there is a gendered dimension to mental health and suicide, which is why, as an organisation, we're particularly passionate about trying to understand the key drivers of poor mental health and suicide ideation amongst men. And really that is the kind of, I guess, the genesis or the backdrop to the work that we've been doing in the UK, where we've been very keen to understand what's going on, particularly for young men, as a result of the pandemic, and to better understand how it's playing out on their mental health.
So what sort of research, Mark, did you guys do of young men under lockdown? And was it in this country?
So yeah, we've been spending a lot of time since the crisis started back in April, better understanding how the pandemic is impacting mental health of men. We've actually been doing that in Australia, Canada, and the UK. And with regards to the UK, we've been exploring and better understanding mental health for young men specifically. We knew back in April that young men were going to bear the brunt of the pandemic and COVID, and it was probably going to be their mental health that was most severely impacted. So we spent time getting really under the skin of what's going on for those men. And it's probably worth saying that specifically lower income men. So again, income status and the social determinants, obviously, of mental health are significant. And so we wanted to better understand lower income men specifically. And we did that in two ways. We recruited 50 young men and have spent the last 6 months really understanding their lives. So through digital ethnography, so working with them via smartphones and a digital platform, they've submitted hundreds of images, text, video. They've given us a real insight into their lives, and we've been exploring themes around masculinity and how that's impacting on their sense of self and their identity. We've been going deep on some of the mental health aspects and better understanding really how they're coping. So it's been a real immersive and in-depth journey, and it's been a real privilege to have been part of their lives. And the reason we've done that is to ensure that as the organisation responds to what's going on, and as we try and put together some solutions, we design those solutions with our audience front and centre. So we know, the ins and outs of how they're experiencing the world around them, how they're consuming media, so that our response can be much more tailored. It's worth saying that we have complemented that real deep dive with some nationally representative survey work. So we've actually spent over 3,000 men from across different income brackets and ages to just better understand how this audience compares with others. And we've done that again across Australia, Canada, and the UK. So we're building up a really rich and interesting picture of what's going on.
And so, Mark, how are men coping? What are the main takeaways?
Well, interestingly, the data is telling us that lower income men, particularly younger men, are faring much worse actually than other, specifically older groups. And so it's that intersection, I think, of life stage and younger audiences, along with kind of lower income that's meaning they're struggling much more. And we've seen 32% of our 15 to 19-year-old audience would hit the World Health Organization criteria for depression, and over 60% of them are technically in poor mental health. So significant numbers of people that are struggling in that lower income bracket and the younger side of it.
Well, those are worrying figures. Is that higher than the women within those demographics?
Yeah, no, we've just been focusing on men, and I think there's actually been some data from ONS recently that suggested that women are bearing the brunt actually of the pandemic more broadly. But I think given we're interested in suicide prevention ultimately, and we're focused, and we know that three out of every 4 of those are male, we're very interested in male mental health and how this is shaping up for men specifically. So we didn't really compare males and females. We've just been going deep on male mental health specifically.
Is there something about the makeup of men that you found that makes it somehow harder for them to reach out and ask for help?
Yeah, definitely. I mean, I think the benefit of having spent a lot of time with these younger guys is that we've been able to really understand their worlds and their social constructs and their friendships and what they're consuming in popular culture. And I think it's given us a really clear understanding that whilst a lot has evolved and changed around mental health, and I think in large part, actually, the pandemic has given us all license to talk much more about mental health, which is a real silver lining, I guess, of everything that's gone on. But these guys are seeing it in their schools, they're seeing it in the media, and the stigma is lifting from mental health. But I think what's interesting in our understanding of what's gone on is that a lot of these young guys, whilst they're seeing and hearing a lot about mental health, they're not internalizing that and applying it to themselves. There's a lack of self-reflection about what does that actually mean for me? When would I classify myself as struggling? When would it be the right time to reach out? How do I reach out? And interestingly, with young men, when it comes to reaching out and exposing vulnerability and finding the language and the ways to reach out, the really sad thing is that that's where men specifically really fall down. And I think our data says that 50% of those young men see being emotionally open as a real weakness. So you can see the extent to which I think some of the sort of old world views about masculinity really hinder young guys from being more open. This idea of being stoic and dealing with things on your own really getting in the way still of those young men reaching out. And also 50% have said that they're not being asked by anyone how they're coping. So it's not just reaching out, but it's also mates looking out for each other. There seems to be a real lack of that amongst these guys. And again, I think it's what we're seeing is it's a lack of that emotional openness and vulnerability amongst men that's getting in the way of that candid, open and emotional conversation.
Yeah, and maybe not just young men. I mean, I found myself under lockdown, I found it quite interesting seeing, how we've only been able to really, we can see socially one other person on a walk. And I watched how I was spending my week and compared it to how my wife was spending her week. And she made sure to get quite a lot of walks in with friends. And I spent my week mostly, I'd take a walk with my wife, with my daughter, but I was basically working. I suddenly realized I hadn't seen a friend for several weeks. And suddenly my life was by degrees just becoming more and more narrow. And then one day I decided, well, actually, I need to sort of remedy this. And I reached out to a friend and we went for a walk and it was like transformative. And then I did it again. It was like, so I just observed how this was such a natural thing for my wife to do. And for me, it was took quite a lot of thinking to actually get to the same point. And it's so important.
Yeah,
reach out.
Totally. And I think guys often bury themselves in work, and that can kind of very much be entwined with their identity. And the idea of self-care and taking time out for yourself, it often comes slightly lower down the pecking order. So yeah, I think this pandemic has probably really, I guess, encouraged guys to think differently about how they're looking after their mental health. And hopefully for many, it's prompting them to take better care.
And also, I think, you raised that point about work is such a big part of identity. And a lot of people have lost their ability to work. They've been furloughed or they've lost jobs. And that really goes to the heart of identity. There's sometimes shame and embarrassment in reaching out about those things as well.
Yeah.
So I think a particularly tough time on that front.
Yeah, absolutely. And I think, people talk about the K-shaped economy and for certain sectors and certain people, it's going to move in an upward trajectory. And for others, it's going to decline and there's going to be a widening gap. And I kind of suspect that might be similar for mental health. Certain people are actually faring okay if they've got more time with family, they've got jobs, as you say, and they've got the means, whereas others are really going to struggle. So I think in terms of access to mental health support, there could well be a widening gap as well if we're not careful. So there's difficult times ahead, and I think your research and Place to Be's research really calls that out.
Well, I mean, it's interesting. You talked about worrying sort of rates of suicide or suicide contemplation, which brings me in mind of why I launched our investigation, one of the most sort of disturbing statistics that I came across was that that young children as young as 5 years old had contemplated suicide. And I just thought, wow, that's just something I'd never heard of. It really hits you in the guts.
Yeah.
And then I did some further research, and we found that an additional 500,000 young people were expected to be impacted by mental health this year. That's on top of the 1 in 6 children already having a mental health disorder, according to NHS Digital, which itself was up on the 1 in 9 in 2017. So already a 50% increase, and on top of that, another 500,000. So and mental health had been steady for a decade before that. So really seeing a big increase. And then the other thing that really fed into that really was, with the lockdown and young people unable to see each other, well, particularly for teenagers, this is how they metabolize the challenges in their lives and their families. They hang out with their friends, and it's not just about wanting to be with friends. There's a real depth of need to be with friends in order to work certain issues out. So that sets us off. And then when I spoke to head teachers, they told me that this was, they expected to get, it was the worst they'd seen, and they expected it to get even worse. And combined with the fact that the government traditionally put very little money into mental health, into mental health services, and actually getting appointments, you could be waiting 6 months for a CAMS appointment. So that led us to partner with Place to Be, who are the biggest provider of mental health services in schools. And they provide a service where they give one-to-one counseling to children who are the most vulnerable, but also they have a drop-in service at lunchtime called Place to Talk. They also help the teachers, then they help parents. And for £33,000, you can get the whole, the full service into a school for a year. So that's what we've been trying to do. Now, I know you've also been involved with a campaign that came off the back of your research.
Yeah.
Tell us a little bit about that, Mark.
Yeah, so exactly. So we set about creating a campaign for young men, and the intention of that campaign was to increase the likelihood that they would reach out for support when they needed it and when they were struggling. And to do that, we worked with social media influencers. We know these young guys are consuming a huge amount of social media. They're very much phone first, and influencers play a significant role in their lives. They go there for inspiration, entertainment, but also information. And so working with influencers from across different passion points, from sport to music and comedy, we wanted them to actually really role model what it looks like to be open and emotional with friends, and to show what it looks like to reach out and talk to someone when things are getting tough, and to show that there's actually real benefit in that. So we worked across 6 or 7 influencers. We've created 4 hours worth of content, touching on different setbacks and different types of conversations. And that's now reached nearly 7 million people. We've had 500,000 likes and comments, and there's a huge amount of engagement with that work. And we're hoping that it goes some way to normalizing the idea of reaching out for support when you need it, in the hope that these young men will reach out to the support services like Place to Be when they need help, and they won't feel that it's emasculating somehow to be open and emotional about how you're coping.
Listening to you, Mark, it takes me back to when I started journalism in the 90s, and my angle, the way I started into journalism, I was a new father, and I was writing about men's issues, if you like, the kind of things that you would find in the pages of women's magazines, but tackling it from a male point of view. How do men respond to miscarriage or when there was an abortion? And how do men feel about being a man, what they love or hate about being a man. And I used to write in those days for the Independent, the Living Page, and it was such a rich source of material back then. And I can see it's still a very, very rich source of material now, and hugely needed. So it's fantastic to speak to you and to hear about this work, and bang on to be sort of looking at how, what vulnerability looks like, and how we can, as men, begin to manage that vulnerability in a positive way rather than a negative way, particularly as we read about so much violence towards women in the pages at this time. And just maybe a last thought today on that. Is there a link between men being unable to reach out when they are struggling and men being violent and aggressive towards women?
I would imagine there is probably a very strong correlation. I think the more emotionally in tune men can be with what's going on, and the better they can articulate their emotions and manage them, the less likely they are to have negative consequences for themselves and for the people around them. So yeah, I would imagine there is a strong correlation.
Well, thank you very much. Fascinating speaking to you today, and also a big thank you for supporting our London Minds event.
Great. Thank you very much, David. Lovely to chat to you.
And thank you everyone for listening.